Okay, so we were doing the parameters on which will be dividing the three major kinds of therapies that are psychodynamic, behavior, and existential therapy. So the first parameter, that what is the cause, we're going to describe step by step. In each of the therapy, there are different causes. Psychodynamic, the cause is mainly intrapsychic conflicts. In behavior therapy, the faulty learning and behavior and cognitions are the cause. And when we talk about existential therapy, so it is mainly related to meaning of one's life and existence, that are the causes of any psychological problems. Second parameter, as we have discussed, how did these causes come into existence? When we talk about psychodynamic, mainly unfulfilled desires of childhood and unresolved childhood fears lead to intrapsychic conflicts. Intrapsychic conflicts के पीछे what are the factors? Unfulfilled desires of childhood. And second one is unresolved childhood fears. In behavior therapy, what are the factors? It could be related to faulty learning, it could be related to your faulty thinking, belief system, the faulty conditioning patterns. All these things are there. In existential therapy, this therapy, keep this in mind, that always give importance on the present. They always emphasize the present. Neither they take past into too much consideration, nor it takes the future too much into consideration. But what it emphasizes on present. So what are the factors? Mainly the feelings of loneliness, alienation, sense of futility of one's existence, which means that there is no meaning of one's existence. One is very confused, not clear about the things. So these are the factors behind the causes of any psychological problem. Now the next parameter, what is the chief method of treatment? Fine. In every therapy, there is a particular, or there are particular different kind of methods of treatment available. When we talk about psychodynamic therapy, two main methods have been used by this therapy. The first one is of free association, and second one, analysis of dreams. As we have discussed both these things in chapter number 2, these are the certain methods used by Sigmund Freud to know about the unconscious part of your psyche. Fine. So psychodynamic therapy uses two kinds of major methods. One is free association. In free association, what is happening? A therapist always encourage the client to discuss, to talk about their feelings, to write down their feelings, their thinking, their conflicts, their fears, and it is freely associated, means that there is no particular question answer form. Therapists just keep on giving positive regard to the client, and client just open step by step. He or she just start telling each and every minute detail, the things which they don't want to discuss with some other people, but they discuss each and everything with the therapist as the therapy goes on, right? Second is analysis of dreams, as this method is of prime importance in psychodynamic therapy, because Sigmund Freud said that dreams are the indirect expressions of your unconsciousness. That means that we are not aware of many things. Those are a part of our unconscious psyche, but still we express them in our dreams. And there are symbols to present those dreams. So the work of therapists is to identify those symbols, those dreams, which are giving the indirect expression of the unconsciousness of the client. Fine. Now in behavior therapy, what is the chief method of treatment? There are different kind of methods, mainly cognitive methods employed in dealing with the challenges or psychological problems. Cognitive methods in these types of methods, mainly your thinking pattern is treated. Their thinking pattern should be logical, it should be rational, it should not be over generalized. So cognitive methods employed basically in behavior therapy for method of treatment. What about existential therapy? This therapy provides a therapeutic environment which is positive, accepting, and non-judgmental. So these three features are very important, that basically the existential therapy is providing a very positive environment, accepting environment, and non-judgmental. As we have talked about the unconditional positive regard, that is more or less similar to non-judgmental. Therapist is not judging the client. He or she is giving a very positive and a very accepting kind of treatment to the client, so that the client start trusting the therapist and start opening its layers of unconsciousness. Fine. So these are the chief methods of treatment in all these three therapies. Now the fourth parameter is, what is the nature of the therapeutic relationship between the client and the therapist? Now the relationship, as we have used a word for this therapeutic relationship, therapeutic alliance. We have discussed in yesterday's class. I hope you remember. So the therapeutic relationship can be used for therapeutic alliance. Fine. Now, what is the nature of this? In psychodynamic therapy, the therapist understands the client intra-psychic conflicts better than the client. Getting my point? Whenever we talk about psychodynamic, intra-psychic conflicts are there. Now, who is understanding these conflicts better? The therapist, not the client even. So the therapist is the person who is observing the things, who is interpreting the things, who is understanding the thoughts and feelings of the client better than himself. Fine. In behavior therapy, the therapist is able to discern the faulty behavior and thought patterns of the client. So here also therapist is playing a very important role. He is understanding the faulty learning patterns also. At the same time, these kind of therapists are also providing effective methods to treat those maladaptive form of behavior. So here also therapist is playing quite a good and important role. So in both psychodynamic and behavior therapy, the therapist is capable of arriving at solutions to the client's problems, and the therapist is playing a very important role. Fine. When we talk about existential therapy, in this, the therapist merely provides a warm, empathetic relationship in which the client feels secure to explore the nature and causes of his or her problems by herself. So what is the difference between psychodynamic behavior therapy and existential therapy? In the earlier, both these therapies, the early therapies, the psychodynamic and behavior therapy, the therapist is helping a lot. He is playing a very important role. Whereas in existential therapy, the therapist is just providing a very good environment, which is somewhere facilitating the client to open up, to express himself or herself freely. But here the client is playing quite an important role than the therapist. Getting my point? So in existential therapy, it is the client who has the responsibility to identify the things, to get out the meaning of the things, to interpret it, to understand his thoughts and feelings. And what the therapist is doing, therapist is providing a very positive, a very accepting, non-judgmental, unconditional positive regard to the patient, which is also very important. Until and unless the client will not be able to share all the things with the therapist. Fine. So this is the chief difference between all these three kind of therapies. Now, fifth parameter is what? What is the chief benefit to the client? Now we talk about the benefits which are provided to the client. When we talk about psychodynamic therapy, it values emotional insight as the important benefit that the client derives from treatment. Emotional insight, two words are there. When we talk about emotional insight, what does it mean? Insight means sudden perception of the solution. You remember, we have done this in which kind of learning? Kohler, insight learning, right? In chapter number 6, 11th class. So emotional insight means the client is now able to get the insight into his emotions, that what kind of emotions he is experiencing, Are they suitable for the situation? Are they correct? Are they of proper intensity whenever they are required? So various things are there. And emotional insight, the client start understanding his own thoughts and feelings and emotions. And insight means a sudden perception of the solution. So emotional insight is the chief benefit which the client is getting in psychodynamic therapy. What the client is getting in behavior therapy? In this, the changing faulty behavior and thought patterns to the adaptive ones as the chief benefit. Earlier, what was there? Faulty learning, faulty behavior, faulty thought patterns. Now it has changed to what? The adaptive ones. Earlier, all it was faulty and maladaptive. Fine. Now the benefit what client has got, that he has changed all these faulty patterns into a very adaptive and adjustive way, and also an acceptable manner. Fine. Now, what about humanistic or existential therapy? This therapy values personal growth as the chief benefit. In this therapy, the client has got the benefit in the form of personal growth. Now, what we talk about personal growth, that it is the process of gaining, increasing understanding of oneself, about one's aspirations, about one's goals, about one's own motives, emotions, right? So personal growth is there, that you start taking yourself seriously, you start having a very positive self-perception, self-concept, and you start realizing the meaning of your existence. Fine. So this is the, you can say personal growth is the chief benefit of humanistic or existential therapy. Now the last parameter is what? What is the duration of treatment? Psychodynamic or psychoanalysis, you know, may continue for several years. It is quite a long therapy which goes on for several years. Whereas several recent versions of psychodynamic therapies are completed into 10 to 15 sessions also. Now they are saying that recent versions which have come of psychodynamic, these therapies, you know, are also completed in 10 to 15 sessions. That means they are not taking too long. They are not going for several years, but earlier it was going for several years. Behavior and cognitive therapies as well as existential therapies are shorter and are completed in few months. So behavior and existential therapies are less time consuming, they are short in duration, and they, you know, might end up or completed in few months. So which is the longest one? The psychodynamic or psychoanalysis therapy. Fine. So this was all about the 6 types of parameters, on the basis of which we're going to describe the 3 basic categories, the 3 broad categories of the therapies one by one. Fine. Now, a simple summary has been given that different types of psychotherapies differ on multiple parameters. They all share the common method of providing treatment for psychological distress through psychological means. The therapist, the therapeutic relationship, and the process of therapy become the agents of change in the client, leading to the alleviation of psychological distress. Now, who all are playing important role? The therapist, the client, the therapeutic relationship, the alliance which they are sharing, right? And the process of therapy. All these are the agents. What they are bringing a positive change into the client. And all these things lead to the alleviation of psychological distress, removal of all problems, of all distress in a client's life. Fine. Now, a very important topic is given on page number 93. Just refer box number 5.1. If you can see, all of you, page number 93, box 5.1, steps in the formulation of client's problem. Formulation means some methods, right? Like if a therapist is starting with a therapy, what all steps he has to keep in his mind before, formulating. Formulation means to describe it methodically. What all methods he's going to cover up. So these are the steps in the formulation of client's problem, which make it more precise, which make it more organized and systematic. So clinical formulation refers to formulating the problem of the client in the therapeutic model being used for the treatment. Now, what are the advantages of this kind of formulation? If a therapist is going through such kind of formulation of a problem, what all advantages he'll be getting? The first one is understanding of the problem, right? If the therapist is clear, has understood the full problem of the client, so the therapy will provide you with better and trustable results. So therapist is able to understand the full implications of the distress being experienced by the client. In understanding the problem, the therapist is trying to understand the distress which is being experienced by the client. Fine. The second one is identification of the areas to be targeted for treatment in psychotherapy. There are certain areas which have to be identified by the therapist for treatment in any psychotherapy. So it identifies the problems and the problem areas, and if a client seeks help, suppose they have given the example, suppose there is a person who needs help. Why? Because he is unable to hold a job, or he is unable to report to his superiors or to his boss, right? There is a problem with a person that he is unable to continue with the job. He is unable to, fulfill the responsibilities. He is not able to face his boss or his, you can say, higher designated people in a very confident manner, right? So clinical formulation in behavioral therapy would state it as lack of assertiveness skills, communication skills, and anxiety. Now, if a therapist has taken, suppose, behavior therapy, fine, this is related to someone's behavior. If a person is not confident enough to deal with his boss or to deal with his job, so it is related to something, behavior therapy. Now, what will be the areas that the person is having lack of confidence, right? The person is not assertive. Remember the word assertiveness, one of a very important life skill. Assertive means to be very confident. Clear communication should be there, that whenever you want to say yes, and whenever you want to say no for something, straight away say no with the reasons. Fine. So the person is lacking in confidence, the person is lacking in communication skills, the person is also not assertive at the same time. So this is all related to faulty learning habits. So behavior therapy will be applied, and therapist is now clear with the areas of the problems. Fine. So this was just an example to make you understand. The third one is choice of techniques for treatment. The choice of techniques for treatment depends on the therapeutic system in which the therapist has been trained. However, even within this broad domain, the choice of techniques, timing of the techniques, and expectations of outcome of the therapy depend upon the clinical formulation. See, the problem has been understood by the therapist. He has also identified the areas of the problem to be targeted for treatment. Now, choice of techniques for treatment. It is very important that which kind of treatment you are opting to treat a particular problem of the client. So this all depends upon the therapist, that how he is maintaining an association and relation between the problems, between the areas of the problem, and between the choice of technique he is opting for the treatment. So this is very important. So all these 3 points are advantages, you can say, And these are the steps in the formulation of a client's problem. Fine. So this is all about box number 5.1. Ma'am, please stop with the recording.